I recently realized that I have cared for over 50,000 patients throughout my professional life. After such a span of time, one begins to recognize trends that clinical manuals simply don't prepare you to see. These are cycles that you start to notice repeatedly. And the specific cycle I am noticing isn't really centered on the critical events themselves. It is actually about what precedes those critical events. The individuals we treat in emergency departments for severe medical issues like heart attacks, strokes, organ failure, or diabetic complications. The overwhelming majority of these people are past the age of 50. This isn't inherently shocking because as we get older, our biology inevitably ages. But what truly disturbs me, the longer I practice in emergency medicine, and really the driving force behind why I started this channel, is how frequently we analyze the tests, look at the results, and find that the crisis at hand has clearly been simmering for years and years, sometimes even a decade or more. And nobody noticed. Or, if they did notice, nobody took the steps to fix it. Modern healthcare is remarkable. We can achieve amazing results, but we are effectively failing at stopping the damage before it occurs in the first place. If this is your first time here, then welcome. My name is Alex. I am an emergency clinician, and my goal now is to prevent you from ever needing to see me in the hospital and to share everything I know about how to stay well and avoid chronic illness. If you would like to support the work I am doing here, the best thing you can do is hit that like button and subscribe to this page. It really helps immensely since only about 25% of viewers who watch are actually subscribers. So please support me, and I will continue creating these guides to help as many individuals as I can. Anyway, what I want to cover in this presentation today is a set of 6 things, 6 digits, 6 markers that I believe every person should be verifying every single year. I am not doing this to over-medicalize your existence or turn you into someone who is constantly worried about their status. Quite the opposite. Those who reach extreme old age usually have the fewest medical interactions over their lifespan. This isn't just about luck. They have maintained themselves so well that serious intervention was seldom required. It is very similar to a car. If you do an MOT every year, monitor the oil levels and heed the warning lights on the dashboard, dealing with small issues before they expand. That vehicle survives far longer than one that only visits a mechanic after something has failed. Your body operates on that same principle, and these 6 items I am discussing today serve as your dashboard. Most of the patients I treated weren't perfectly healthy and then suddenly collapsed. They had felt a bit off for a while. They felt a type of exhaustion that seemed a bit different for a long time. They felt short of breath during tasks that never used to wind them, or they felt mentally hazy, or had odd tingles in their limbs that they couldn't explain. Almost universally, they dismissed it as just getting older, which is a logical assumption because when symptoms develop slowly over months or years, your brain adjusts. These changes become your new baseline. Since you only ever live inside your own body, you have no alternate version of yourself to compare your current status against. You cannot know if the fatigue you feel is normal for a 55-year-old, or if it is a sign that something else has been quietly going wrong for the last 5 years. So, what is actually happening with these patients when we do these scans? A lot of the time it comes down to a few basic factors, or a mix of them. None of them are pricey or complex. They can be measured with a simple test, often done at home. The first marker is blood pressure, because it surprises most people. when I explain the damage it does over decades. High blood pressure is termed the silent killer, which feels like a cliché until you see its impact on people past 60 or 70. It is silent because it truly doesn't feel like anything for a very long time. Your vessels are under higher pressure than intended every single day, year after year, and they are being quietly ruined by it. The vessel walls thicken and turn rigid. The heart strains to move blood through them. That means small vessels in the brain, kidneys, and eyes are damaged until one day something finally gives way. A vessel in the mind might rupture, or the heart, exhausted from years of extra work, begins to fail, which is what we call heart failure. Or perhaps a kidney that has been struggling for a decade suddenly enters a state of dysfunction. We see these things in A&E all the time. We look at the history and see that their blood pressure has been high for years. This is the common story. Sometimes they knew and weren't treated effectively, and sometimes they had no idea at all. A monitor is extremely cheap, less than 20 or 30 quid, and it provides your most vital data point. You want to see roughly 120/80 or lower. If you are very elderly and frail, we like it slightly higher just to prevent falls. Anything regularly past 130/85, if you aren't frail, is something to discuss with your GP, because mild elevation does real harm over time. Number 2 on our list alongside blood pressure is a high resting heart rate, RHR. Most don't think about this, but an RHR sitting above 80 or 90 beats per minute while you are resting is a vital signal of strain. It reflects a heart and a nervous system under stress or metabolic dysfunction. A healthy resting rate is usually between 50 and 70. My own RHR is around 45, and I once treated an athlete with a rate in the 30s. He was just in for a sore ankle, but all the clinical alarms were going off until we realized how fit he was. You can measure yours now by counting the pulse on your wrist for 30 seconds and doubling it. If that result is above 80, you should pay attention. Most smartwatches measure this constantly and provide a resting average, which is even more useful than a single spot check. Third is your kidney function, which we verify for almost everyone in the department. Most people never think about this until it is too late, even though it's been dropping for years. Your kidneys filter your blood, manage fluid, and regulate pressure every day. They are delicate and prone to damage from high sugar, high pressure, or inflammation. The trouble is that they are great at compensating, meaning you can lose most of your function and feel absolutely no warning. We see people with breathlessness or confusion, only to find severe kidney failure that was hidden for years. This is a marker you definitely need a blood test for. Your eGFR, estimated glomerular filtration rate. It is a standard part of any panel your doctor can order, or you can get it done privately, for roughly 50 to 100 quid. If you do it once a year, it is well worth it. Next are triglycerides and LDL cholesterol. I want to be careful because the talk around cholesterol is currently very loud and confusing. I made a video regarding statins that became popular. Watch that if you are wondering whether to take one. The evidence is consistent. Long-term high LDL and triglycerides contribute meaningfully to the plaques inside your vessel walls that cause strokes and cardiac events. You cannot feel this plaque building up. There are no symptoms at all until the crisis occurs. It is an easy blood test that your GP can do for you, and if they won't, go through a private lab. Next on the list is blood sugar, which is the marker most people underestimate, but is also the easiest to improve. We run glucose checks in the A&E and often find people are running high, perhaps not quite at diabetic levels, but too elevated nonetheless. We then check an HbA1c, A1c in the U.S., to see the 3-month average. When this is high, it tells us the system has been struggling for months. That is the environment where vessels and nerves get ruined. Healthy HbA1c is below 42 in the UK, or 5.7% in the US. The lower, the better. You can fix this through post-meal walking and including more fiber and protein in your diet. Finally, the last marker today is your LFT, or liver function test. This is a common cheap test we do, and we frequently find abnormal results in people who had no symptoms. Most often, the reason is fatty liver disease, driven by modern diet, metabolic health, and lack of movement. Too much sugar and refined carbs combined with low activity causes fat to build up in the liver. This doesn't cause pain. The organ just becomes less efficient and more inflamed over time. A damaged liver messes with your blood sugar, your hormones, and your medication processing. It is vital to check. If your enzymes like ALT or AST are high, meaning they are leaking into the blood from cell stress, you need an appointment, a medical history, and perhaps an ultrasound imaging. This discussion isn't meant to cause fear. It is meant to show you that the technology to see catastrophes coming already exists. Most people maintain their cars more than their bodies. They follow an MOT schedule, but drive their bodies for 10 years without ever checking the dashboard. Most of us wait until we are in the A&E before realizing our problem has been growing since our mid-40s. Most think they are healthy until they suddenly age and get sick, but it's a process. Use your GP for these tests, or do them yourself. Buy a BP cuff and a smartwatch. It gives you step counts, sleep data, and your heart rate baseline. All of these checks are valuable because they give you a starting point. If you know where you stand, you can catch a shift while the window for repair is still wide open, rather than waiting until it is nearly closed. Remember, chronic disease symptoms are incredibly subtle and sneaky. They feel like normal daily life or just getting older. That tiredness you attribute to stress, or the breathlessness you attribute to being out of shape, might be a signal. The memory that feels less sharp or tingles in the feet could be diabetes. These signals feel unremarkable because they take years to arrive, and your mind just adapts to them. Because you have only ever lived in your own skin, you have no other frame of reference. The only way to know is to measure regularly, as if your life depends on it, because it likely does. The majority of what I see in my department is completely avoidable. It isn't an inevitable part of getting older. It is the end point of a decade-long cycle. I'm not blaming anyone. Our system is excellent at crises, but poor at prevention. That means most of the prevention has to come from you. Treat your health like your most vital asset, because it is. Those who lived long, healthy, independent lives are those who stayed out of my hospital because they took the MOT approach to their own bodies. Use these 6 signals: pressure, pulse, A1C, kidneys, lipids, and liver as your starting point. Explore the rest of the channel for more detailed talks on how to fix these specific numbers. Each marker is pointing to a lifestyle factor. High pulse often indicates stress or low fitness. High sugar points to your diet and a sedentary life. Poor kidneys might point to pressure or glucose issues. None of these exist alone. They are just cues that give you time to act before you become a case that enters my hospital. If any are high, get a sit-down appointment for a full medical history. That is the bare minimum you deserve. I hope this was useful. If so, please like and subscribe and tell me what you'd like me to address next time.